Welcome back to Ask Our Nutritionist. This is our second video of our mental health series. Thanks for tuning in. Thanks for subscribing, and following and commenting, people. I appreciate all the assistance, and I appreciate you tuning in. So let's get back down to it. Cdc.gov is the resource for this one, and it goes in the covers. Mental health basics. What is mental health? Myths and facts. Recovery is possible. And it's going to go into some details. So mental health problems are common. However, most people with mental health can get better. Some of the myths and facts: know the facts, use your knowledge to educate others, and reach out to those who may have mental health problems. So you want to reach out to them. Recovery is possible. Treatment and recovery are an ongoing process that happens over time. The first step is getting help. So some of the myths and facts. Can you tell the difference between a mental health myth and fact? Learn the truth about the most common mental health myths. So let's go into it. Mental health problems affect everyone. What you think? I think so. So that is a myth. Mental health problems don't affect me. Most people who think like that, you got to just think what one person does. Yeah, it might not directly affect you, but it does affect their family and the surrounding circle around them. So let's go. And the mental health problems are actually very common. In 2020, about 1 in 5 American adults experience a mental health issue. 1 in 6 young people experience a major depression episode. 1 in 20 Americans live with a serious mental health illness, such as schizophrenia, bipolar disorder, and major depression. Suicide is the leading cause of death in the United States. And that number right there is just ridiculous to me, because I had a friend of mine who was a victim of this himself. So I'm going to talk about that in a different podcast when I get on this subject. But it's the leading cause of death in the United States. In fact, it is the second leading cause of death of people ages 10 to 24. So now it's affecting our younger generations. And that's also ridiculous. It accounted for the loss of more than 45,979 American lives in 2020, nearly double the number of lives lost to homicide. So, I mean, I know this world is hard and it affects everyone, but that number right there is just ridiculous to me. So myth: children don't experience mental health problems. That's a fact. Even very young children may show early warning signs of mental health concerns. These mental health problems are often clinically diagnosed and can be a product of the interaction of biological, psychological, and social factors. Half of all mental health disorders show first signs before a person turns 14 years old, and 3/4 of mental health disorders begin before age 24. So it occurs very young. Unfortunately, 1/2 of children and teenagers with diagnosed mental health problems receive the treatment they need. So only half of those children actually seek help. So that is telling me that the parents are not reaching out if they think the child needing help. It's nothing wrong with it. You just get them the help they need, and hopefully your child will recover. So it's all about support, especially your children, man. You want to take care of them and do whatever you got to make sure they're healthy. That's our future. So we're not going to be here forever. Early mental health support can help a child before problems interfere with other development needs. So let's go into a myth: people with mental health problems are violent and unpredictable. Fact: the vast majority of people with mental health problems are no more likely to be violent than anyone else. So they just telling you, the fact is, you think that people with mental health problems are violent and unpredictable, but it's just showing you that the stats say the vast majority of people with mental health problems are no more likely to be violent than anyone else. So it's all on the individual, or if they're having an outbreak or stuff like that. So you can never discriminate against these selected few people, which is half our population. So most people with mental health issues or illnesses are not violent, and only 3 to 5% of violent acts can be attributed to individuals living with a serious mental illness. In fact, People with severe mental illness are over 10 times more likely to be victims of a violent crime than general populations. So this is telling you now that people with mental illnesses are a select few that other people pick on them, or they're more violent towards them. So that's just telling that what kind of world are we living in now, when the population with people who need help are the ones who being more victimized. Um, so um, you probably know someone with mental health problem and don't even realize it, because many people with mental health problems are highly active and productive members of our community. So, that's just saying a lot of people have mental illnesses or problems, but they don't share it to too many other people, just because, as you can see, people understand that and they start picking on them, and that population group is discriminated against a lot. So we just need to change all that stuff like that, man, and start shedding light on mental health. That's why I'm doing these series or topics. This is to raise the discussion, man, raise awareness. And it is Mental Health Month, so we just need to do better as a people, no matter what, especially for our young generation. That's going to a myth. People with mental health needs, even those who are managing their mental illnesses, cannot tolerate the stress of holding down a job. Let's see what the facts say. People with mental health problems are just as productive as other employees. Employers who hire people with mental health problems report good attendance and punctuality, as well as motivation, good work, and job tenure on par with or greater than other employees. So it's saying with mental health people, you can't discriminate against them, because they're sometimes more than the most hardworking people that you can hire. They might have some disorders, but you work around that, and they're gonna put out the work for you because they appreciate it. They know it's gonna be a little harder for them, just like any other population that's discriminated against. You're gonna work your best to do whatever you got to do to take care of your family and what's right for you. So I had an officer who had bipolar disorder, and she was amazing, man. She'd have her mood swings and stuff like that, but never in public. She'll only do that in private, and I talked to her a lot and stuff like that. But she was one of the most hardest working people I ever met, standing on the feet for hours and stuff like that, man. I mean, it's amazing how people look at other people and just look down on them or whatever else, or judge them. I wasn't raised like that, so let's continue. That's going to a myth. People with mental health needs, even those who are managing their mental illnesses, cannot tolerate the stress of holding down a job, which I already covered. Now it's going into some of the lower total medical costs, increased productivity, lower absence, decreased disability costs. So that's all associated with people with mental illnesses holding down a job. And you can see the stats are rarely in their favor, than the general population. So it's going to a myth. Personality weaknesses or character flaws cause mental health problems. People with mental health problems can snap out of it if they try hard enough. Let's see what the facts say. Mental health problems have nothing to do with being lazy or weak, and many people need help to get better. Many factors contribute to mental health problems, including biological factors such as genes, physical illness, injury, or brain chemistry. Life experiences such as trauma or history of abuse, family history of mental health problems. So the fact saying that, they just can't snap out of it. You got to get help first. You got to realize that you have a problem, and you just reach for help. Depending on your family, or have a great support system. Or if they not recognizing themselves, you reach out to them, you talk to them, you get them help. And just slowly, just try your best to benefit that person. People with mental health problems can get better, and recovery, and many recover completely. So let's go to helping individuals with mental health problems. And let's go into a myth. There is no hope for people with mental health problems. Once a friend or family member develops mental health problems, he or she will never recover. And let's see what the facts say. Facts say, studies show that people with mental health problems get better, and many recover completely. So don't listen to what people are saying. If they got a mental illness, they'll never get better, or they look down on them. And I know it's hard to have faith and just look for it, but it's all on the help that they receive you got to find the right type of help in the system who gonna, try to do what's best for them. So and recovery refers to the process of which people are able to live, work, learn, and participate fully in their communities. There are more treatment services and community support systems than ever before, and they do work. So let's cover a myth. Therapy and self-help are a waste of time. Why bother when you can just take a pill? And a lot of people know me. I believe in natural substances, herb stuff, tea, anything that's produced from the earth and stuff like that. I don't believe in too much medication, but I do understand the importance of getting the right medication with the least amount of side effects to help an individual. So you got to do whatever's right for you. If it ain't no alternative naturally, I believe that you need to go ahead and take that medicine your doctor prescribed in a lower dosage, or the dosage that's correct for you. I don't believe in abusing anything, and that comes with health supplements or energy drinks and whatever. It can be beneficial for you, but it's still you got to be moderation on whatever you take or whatever you drink, eat, just like anything else. So let's cover a myth. I ain't never going to the treatment. So fact for that is treatment for mental health problems varies depending on the individual and could include medication, therapy, or both. Many individuals work with a support system during the healing and recovery process. So that is a fact that therapy is not a waste of time. Pills could be optional, but you have to do therapy or both. And many individuals do recover after the healing process. So let's cover a myth. I can't do anything for a person with a mental health problem. Let's see what the facts say. Friends and loved ones can make a big difference make a big difference. We all know that, but sometimes we get too busy and we don't want to help, but it's our job to help people. They're not in this alone. So we're all in this together. So, and that's going to 2020. Only 20% of adults received any mental health treatment in the past year, which included 10% who received counseling or therapy from a professional. Friends and family can be important influencers to help someone get the treatment and services they need by reaching out and letting them know you are available to help, helping them access mental health services, learning and sharing the facts about mental health, especially if you hear something that isn't true. Treating them with respect, just as you would anyone else, refusing to define them by their diagnosis or using labels such as crazy instead of person first language. Like I said, you should never talk down to nobody. You should never really call them crazy. And I just retired from Georgia Bureau of Investigations, man. I was director of security, and I took that over for approximately 5 years. And you can imagine the people that I encountered who are mentally challenged or facing a hard event, from the general person to ex-FBI agents, people who just was going through mental health problems due to stress of life and stuff like that. Like I said, you see the stats 1 in every 5. So 50% of our population is going to experience some type of event. And I remember a young lady, she was an ex-FBI agent, PhDs. On paper, she was a genius, smarter than anything out there. But like I said, it can be triggered by a trauma or something. And I can imagine the stuff that she faced in this world. And you never know. So I think we was able to get the help she needed, and hopefully she didn't recover. But I'm not doing that job no more. I done finished that, so I can concentrate on doing what I'm doing now, helping spreading awareness, helping do what I love. I mean, training still at Mentalhealth Gym in Georgia, doing my nutrition stuff online, just helping people just live a healthier lifestyle. So, I got my own goals that I want to achieve, and that's it. And, making healthy lifestyle supplements that everybody can take, not just fitness athletes and stuff like that. I mean, daily, I take my organic greens for my digestion and gut health, helps my skin, helps acid reflux. Everything I try to do is thinking about longevity and benefit of people. So you just got to do what's right for you. And I think I probably do something covering my last experience before I left GBI down here in Georgia, man. 'Cause we covered, you name it, Ahmaud Arbery cases and all the top cases. We got all the information at Georgia Bureau of Investigations, and came up with a lot of stuff to help people. So, I done had to turn away people who was in the need of expungements and stuff like that, trying to get the background cleared. And that's why I started my nonprofit, to help those people like that. So, like I said, 2022, we're trying to help a whole lot of people. We're going to do a whole lot more to spread awareness, help educate, and help people get back on track, man. That's what we're here for. That's my expertise, is law enforcement, expungements, backgrounds, pardon, paroles, fitness, and nutrition. That's my expertise. So why not share and help people who are in need of it? So you got to do whatever you was put on this earth to do. And that's one of my gifts always. And I embrace it. I'm an expert at what I do. I'm not bragging, or some people look down. They don't like to say that. But if you're an expert in what you do, you need to embrace that and own it. And help the people who's not an expert or who doesn't have the experience like you. We all still learn. So I learn stuff every day. So we're all capable of learning. So let's go with recovery is possible. Most people with mental health problems can get better. Treatment and recovery is an ongoing process that happens over time. What is recovery? Recovery from mental disorders and or substance abuse disorders is a process of change through which individuals improve their health and wellness. Like I was saying, health and wellness, everything connects together. Live a self-directed life, strive to achieve their full potential. And we're going to go into 4 dimensions of recovery. 4 major dimensions support a life in recovery. So 4 major dimensions support a life in recovery. 1 is health, overcoming and managing one's disease or symptoms, and making informed, healthy choices that support physical and emotional well-being. Home, have a stable and safe place to live. Purpose, engage in meaningful daily activities such as a job or school, volunteering, caring for your family, or being creative. Work for independence, income, and resources to participate in society. Community, build relationships and social networks that provide support, friendship, love, and hope. So that is our 4 dimensions of recovery. Now we're going into develop a recovery plan. So if you are struggling with a mental health problem, you may want to develop a written recovery plan. I believe in right now anything, your goals, a dream board, a future board, whatever you want to call it, but you have to write it down, people. We're not going to remember everything. And it's always better to write it down so you can have something to refresh your memory. So recovery plans, they need to enable you to identify goals for achieving wellness. Specify what you can do to reach those goals, include daily activities as well as long-term goals. And I believe that. Track any changes in your mental health problems, identify triggers or other stressful events that can make you feel worse, and help you learn how to manage them. And with this recovery plan, man, I don't think this is just for people with mental health problems. I think everybody can benefit from having or developing a recovery plan. And I have one. I do it, like I said, daily pretty much. And I have to, trying to do the fitness influence and stuff and the nutrition. And I got my clients and coaches. I have to have a journal or something like that to write down all my information and stay focused and stay, into it. So as you can see, I got one right here, and this one is all toe up, and I got another right here. So you got to, do that, and it is greatly beneficial. So what to look for? Anxiety disorders, behavioral disorders in children, eating disorders, mental health and substance co-occurring disorders, mood disorders, personality disorders, self-harm, suicidal behavior, post-traumatic stress disorder, and that stuff like that. And like I say, I've been in law enforcement 20-25, a long time, most of my career. My mom knows family, so nurses. So healthcare and security or law enforcement, the military is my family's background. And I believe all of us are pretty much experts in that field. And I used to work in a mental facility. So learning the disorders and stuff like that. I mean, it's stuff I had to learn. I had to learn all this stuff. I had to talk with these people. I had to deal with them every day. And I end up meeting ones who did self-harm, and I try to talk to them and figure out what was their triggers and what they get from it and stuff like that, or the suicidal behavior. So all this stuff like this we dealt with, we learned their triggers and stuff like that. So that's a whole different podcast and story in itself. Working with mentally challenged people who are institutionalized, I put it like that. So let's talk about mental health. So for people with mental health problems, for the young people looking for help, for parents and caregivers, for friends and family members, for educators, for community and faith leaders, conversations in your community are important. So like I said, that's why I'm talking about it now. That's why I'm doing this podcast. That's why I'm doing a series on mental health, because we got to change these stats, man. We got to get our people help, our family and our friends, or ourselves at one point. So we need the help available to help ourselves. So how to get help? You get immediate help from service members and their family members, disaster distress helpline. You got health insurance and mental health services. You can participate in clinical trials. You do whatever you got to do to get help, or you just ask for help. So if you see somebody struggling with it, you can call a hotline, you can call their family member, or you can let somebody in their family know if they don't believe it. So, you always want to do that. So what is, let me see, mental personal experiences. Okay, so now I'm going into I just jotted down some notes that I'm gonna cover, and that's gonna go into my mental health personal experiences. I had a friend of mine, which was ended up being a relationship, my ex-girlfriend. Her cousin, I think, put it like this. She was a nurse, and she'll tell her aunt or whoever her relative that this guy, which was her cousin, was experiencing mental health issues and stuff like that, and they try to get him help. They took him to a facility or the hospital to try to get him help, and then pretty much they were saying he might need this, he might be depressed or whatever the case, but they didn't properly diagnose him. And then one of the worst situations happened. He ended up killing his mom by decapitating her. I put it like that. And it was a sad situation because she did everything she could, I believe, at that time to get him help, but nobody actually believed it. I don't think the mom at that time believed it. She knew he was having issues, but I don't know if that was the only boy or he was the only child. It's just hard when you have a relative. Sometimes we get blind to it, just like you say, I guess like being in love. When you have those people, spouse stepping out or whatever the case, love is blind, they say. So, sometimes you got to have a second eye to look. Like myself, I'm a coach, I'm a nutritionist, I'm a lifestyle coach, but I have my own coach also. And I talked to a pro, I think it's Dexter Jackson, he used to coach me a little bit, and he was like, hey, even though he's been doing this, he's the most winningest bodybuilder on the planet, he still has a coach. So even though you got the knowledge and education, that second eye is undeniable. You need it. You need an extra support system because sometimes they can see something that you can't see. And you see yourself every day, so you're gonna miss some things. And I agree with it. So I'm gonna go with the past job experiences. Like I was saying, the mental health facilities that I worked at was like CCC, Just Care. And there was a mental ward I was security, and we was private, stuff like that. So you had to do one-on-ones. And when I worked at the hospital, man, we had to sit on one-on-one patients, psych holes, and you had people digging in themselves or cutting themselves, swallowing stuff, sticking in their stomach. And these was people who was institutionalized, not at the hospital, general hospital, as well as overdoses and stuff like that. And, as a security in the hospital, you got to sit on them. So you got to, these are just average people. And once you start, experimenting in recreational drugs, they could have an effect on your mental stability. So you have people I remember a guy, he came in, I don't know what he was high on or what he took, but when they ran the blood test and stuff like that, it was undetected in his system. But if you looked at him, he thought aliens was coming down to take him and all kind of stuff was going on. And I think they found him on the highway running butt naked. You never know. And you couldn't find whatever he took, you couldn't find it in his system. So just imagine what kind of drugs that is out there. Now they're lacing stuff, so it's more dangerous yeah, you whatever high you need to get and stuff like that, I couldn't do drugs. So I never wanted to be outside that body. That's why I told you I don't drink, because of how I think it affect my genes or my genetic code, by making us aggressive and stuff like that. I just never want to be that type of person. And I done seen someone get alcohol poisoning, and it was like a demon in their body. And that kind of scared me a little bit. I was like, 'cause I do believe in, like I said, I'm a spiritual person and religious. So I do believe in a lot of that stuff that the Bible said. I don't know about you, but I'm lucky to still be alive. And that, like I said, we'll talk about that another time when we get there, but we're not on that podcast yet. But like I say, when I was at GBI, man, I got phone calls from people every day thinking of bombs and mental health. And you got the process of elimination. You got to establish which calls are legit and which calls are not. Even though we got the tip line, the help line over there, they are transferred to me because what? I'm the best at what I do. So I can, I generally, and I did this every day over 5 years, man. To see something, say something, we came up with that, now you see it's big out there everywhere. So even the help line, I tell you, I'm not proud. Like I said, I'm an expert, especially in law enforcement out there. I was the best director of security they'll ever get, because what? I went above and beyond. I researched all the laws and stuff like that, like, because I want to help people, and I don't believe in how big GBI is and all the help that and assistance they get with the public, that you need to have somebody in charge, especially even if it's security or whatever the case, that's uneducated or don't know the laws or what other business that they have to handle. So I had to learn every department. I had to learn from biology, chemistry, toxicology, partner paroles, helpline, tip line, FBI dealings, you name it. I had to learn everything, and I did, just to make sure I was efficient in what I did, so I can help educate my officers, help make sure that everything else runs smoothly. So nobody told me to do it, but whatever I do, I want to be the best. I want to present myself like I care. I want to do it, and I actually do. I enjoy what I did. So, but that phase is over. So now I'm doing what I love to do now, and I'm also being able to help people get their life back on track. So, what else is better than that? So, to wrap up with this section right here, man, we're gonna go into a couple wrap up questions, and this will be on that Q&A. Number one, questions. How can we help someone who we believe may be experiencing a mental health issue? Number two, what steps can we take to strengthen our mental health? And that can be daily, weekly habits, or routines. Number three, what steps can we take in recovery to improve our mental health problems or issues that we are currently facing? Number four, what kind of support systems can we establish after recognizing or accepting the fact that a family member, a friend, or ourselves are experiencing a mental health problem? And number five, what are some things that we should attempt to avoid when dealing with mental health issues? And that's our wrap up questions. This is still part one of our mental health series. Part two, I'm gonna have a special lady who I'll be interviewing. I'm not gonna say her name here, but I will do a special introduction to her, and I have a whole interview panel that's laid out for you. But I thanks y'all for tuning in. It's your boy Cut Nice 50. Thanks for tuning in to Ask Our Nutritionist. Don't forget to like, subscribe, and follow for any links or supplements down below. You're trying to get your transformation on. Everything will be down below. I appreciate y'all for tuning in. Until next time, we are